Good afternoon. Welcome to the first Regulators Forum of the Standards and Policy Hub. The aim of this short presentation is to familiarize you with the xShare project that hosts the Hub and also share some of the early results. xShare is about expanding the European Electronic Health Record Exchange format to share and effectively use health data within the HDS. This means that we are not limiting ourselves to the priority data categories mentioned in the regulation, but we look at the whole environment and try to identify additional priority data categories like the IPS for research and care plans that could make more meaningful and useful the format in the European health data. The vision of xShare is that everyone can share their health data in a computable format. That's the European Electronic Health Record Exchange format. And that will happen at the click of a button, adding a lot of activity in the European health data space. For that purpose, we have brought together 6 standards organizations, global standards organizations, CEN, HL7, CIRDISC, IHE, IEEE, and SNOMED, and also 3 leading industry associations, Digital Europe, Medtech Europe, and UGROV, to put together the 3 main elements of implementing the vision of xShare. The first is a button, an empowerment through the yellow button that will be featured in apps and websites. The second is the hub, an activity of which we are doing right now, which brings together global standards with industry and government to steward specifications and accelerate their adoption. And last but not least is an industry label, which demonstrates commitment of the industry to implement the format and also the capabilities of specific applications. But what are we going to implement specifically? Specifically, our aim is to demonstrate the impact of xShare across continuity of care, that's the button, clinical research, and population health. We will start with 9 adoption sites and select 25 additional ecosystem partners to accelerate adoption across European member states. We will try to demonstrate safe, trusted, and low-cost sharing of high-quality health data that are structured and coded. We will also demonstrate movement of digital health services across Europe and globally through standards. This will drive Europe's competitive advantage in research and innovation in the health DS at an era that is characterized by artificial intelligence methods and big data. And in this context, the Hub will serve as an accelerator, contributing to the adoption of global standards and the format. How does the project look like from a structural point of view? We have 3 work packages that focus on the 3 sectors: the primary use of data with xShare button and the empowerment of the individuals, the public health, population health, and cross-border health rights one, and the format in clinical research with the core data set and the IPS for research. All of this will be centered around the hub, which will work in a PCDA cycle, starting and ending in global standards, driven by business use cases, assurance testing, live deployment, feedback and maintenance, and forums and a community that actually works on consensus. We will work not only at the member state level, but also at regional and hospital level. 3 work packages will also help us diffuse and support us. The first would be a monitoring framework in the HDS. The second one was about capacity building, cybersecurity and privacy and innovative procurement. And the third one is the more business-oriented, linked to the xShare industry label, testing its feasibility, articulating policy recommendations, and testing the viability of the effort. So, are you ready for this xShare button? We have a large consortium supporting us here, but we need you. And we need you to connect health and care with clinical research, population health in the European Health Data Space. So please join our community. This is the information to do so. Thank you.